Okay, well, thank you everybody for joining today. I think we'll have some folks who are joining us here as we get going. So, excuse the dings. But my name is Dan Olson. I'm the executive director of the Vermont Public Health Association, and really excited to be hosting today a really fantastic career panel with some impressive public health professionals. Before we get started, I just wanted to introduce the Vermont Public Health Association to people on the call in case you're not familiar with us. VtPHA is Vermont's home for public health professionals. We really focus in on education, mentorship, and advocacy work. And this panel is really kind of at the mix of our education and our mentorship roles. We really want to help to highlight the different and diverse careers that exist in the public health field by bringing the stories directly to our members and to the public through panels just like this. So if you're not a VtPHA member, there's a little QR code. You can always go onto our website and sign up. We have lots of great events coming up in the next few months. So if nothing else, do go to our website and check out our events page. And with that, I'd like to introduce Sally Kirshner, who is going to give a little background on public health nursing before we move into our panelist presentations.
Okay, hi, you can hear me, yes?
Yes.
Yeah, I'm losing me on the list. Okay, so I'm Sally Kirshner, and I'm presenting with Margaret Robinson, who is on this call by phone. And Margaret and I worked many years together at the Vermont Department of Health in as public health nurses, and Margaret is still working there. I'm retired. Margaret's still working there as a director of public health nursing. And we are working together with an advisory group to create a public health nursing section within the Vermont Public Health Association. So that's been ongoing for I think we've been working on it for a year. We've been working with some students who've done background research for us, some UVM students, and we're starting to have these regular webinars overall with the Public Health Association and offer other services. One thing we've been talking a lot with the universities and schools of nursing about how can we support a variety of public health clinical placements and help to amplify to nursing students. As you're considering your career, don't forget public health nursing. We're having Dan said you're welcome to join the Vermont Public Health Association, and as you do, click that you want to be active in the public health nursing section. And then we're having our annual meeting in Burlington on April 29th. This is like hot off the presses from 4:30 to 7:30, and more information on that will be coming, but we would like to have a little meet and greet for the public health nurses at that annual meeting. So that should be fun. Just to kind of frame up this discussion, a lot of people, even those of us who've worked in public health nursing, we always need to revisit what is it and how is it defined. And Margaret did this nicely referenced slide or two about what is public health nursing. And you can see here is the practice of promoting and protecting the health of populations using evidence-based practice, focuses on a population health through health promotion, disease prevention, and risk reduction. It also, I always think about public health nurses as working within systems and knowing about the system that supports everything from individuals and families to communities, and then the overall population of the catchment area. So the practice of public health nursing is guided by the American Nurses Association. The scope, their document on the scope and standards of practice in public health nursing organizations' core competencies. And the other thing that Margaret and I have found over the months as we've done research, we've talked to the people at the Colorado Public Health Association, and they have a few nurses there who've done some great work in defining what is public health nursing. They found that, especially during COVID, a lot of county health departments were hiring on extra public health nurses or had public health nurses and didn't know what to do with them. Were asked, I'm sure you've all experienced this. they're asking nurses to do things outside of their scope of practice, but they're not using them properly and asking them to do things within their scope of practice and skill set. So another good reference is just if you get on the Colorado Public Health Association website, it's pretty easy to find on there. So the next slide, is there another slide? Oh, here's the some resources at the Association of Public Health Nurses. They're having their big annual meeting in May, so you can get on their website and find out about it. That's all virtual, which is interesting. They thought it was too expensive. You know, it's going to be like $1,000 to register for this conference. So they're having it 4 days over 4 weeks, and it's all virtual in their way of trying to make it more equitable. The Vermont Public Health Association is an affiliate of the American Public Health Association, and they have their public health nursing section, which has a lot of references and resources, and the Council of Public Health Nurse Organizations. So I'll stop there. Dan's going to let us ask questions at the end, but I'll stop there and let the next presenter go.
Yeah, thank you so much, Sally. And our first panelist today is going to be Alicia Butler from Addison County Home Health and Hospice. Take it away, Alice, or Alicia, sorry.
Hi there. As Dan said, my name is Alicia Butler. I work for Addison County Home Health, but in that role, I'm the SASH nurse for all of Addison County. SASH is Support and Services at Home. That's what it stands for. And it's a free program that's funded mostly through grants for primarily participants that have Medicare. There is a small section that also has families and children, but not in my county. So I just see senior citizens and I see them in their homes. I have 4 hub sites. So I cover Middlebury District, Virgins, Shoreham and Orwell, and then a Bristol panel. And each grouping is a panel. I have about 300 participants that I'm responsible for seeing. As the wellness nurse, I do home visits with them. I do annual assessments. I'm in contact with their providers. I work with elderly services, aging or council on aging. We call it Age Well in our county, but I believe it's council on aging in other counties. We all sort of work together as a team to keep these participants living in their home longer, bring services to them at their home so they don't end up in nursing homes if that's not where they want to be. We also help facilitate the transition to nursing homes when they're ready and when that's their choice. So a lot of care coordination goes into it. And I really enjoy it. I think it's great getting to be welcomed into their homes, meeting their families. Sometimes you become the family that they don't have. I work closely with the SASH coordinators, which each panel gets a SASH coordinator. The wellness nurse position is a little bit unique. I get certain hours per panel. So I divide my time through the week in different places, but for the most part, it's a really great job. I was attracted to public health nursing when I had children. The schedule is much more ideal for a family. I've got 4 young children. I started in the hospital. The nights, the weekends, the rotations, it wasn't really a good fit for us at that time, but that's one of the things I love about nursing is that there's so many choices. And I really got pulled into public health, and it's where I'd like to spend the rest of my career.
Great. Thank you, Alicia. That's really that's fantastic. Thank you for that. And we'll hold questions to the end in case anyone has them for Alicia. But let's move on to Cindy Ingham. And Cindy, I will put up your presentation now.
Can you move that forward, Dan, to my slide deck?
Yep. You see that?
Nope.
Oh, sorry. I think I've turned the wrong one. My mistake.
There we go. All right. Thank you. Hello, everyone. And thanks for this chance to let me tell you a little bit about my nursing career in the field of public health. Currently, I'm the executive director of the New England Regional Genetics Group. That's NERG, not NERD. And I'll tell you more about that at the end. Next slide, please. I was privileged to be selected for the Walter Reed Army Institute of Nursing program way back in 1969. I did my first 2 years of didactic nursing studies at the UVM School of Nursing, and then moved to Walter Reed in Washington, D.C. for my clinical experience. This was affiliated with the University of Maryland School of Nursing. My student public health assignment was the Prince George's County Health Department in Maryland. And you'll see this county map here. It was an area characterized by great discrepancies. The north was bordered by Montgomery County, which is still one of the wealthiest counties in the entire United States. To the west was the District of Columbia, the home of affluent and powerful people who made the rules and the laws which affected the most underprivileged people in the country. Prince George's County, where I worked or studied, had significant socioeconomic inequality and racial disparity, especially when viewed against the backdrop of the centers of power just a few miles away. Those who made the laws often had very little knowledge of the needs or experiences of the people whom those laws impacted the most. On my very first visit, it was a scheduled appointment, a routine maternal child health visit to check on a young woman with a new baby. The door to the family's apartment was riddled with cracks and dents, which I later learned were from being kicked in multiple times by an angry boyfriend. The new mother let me in with a tentative smile and called to a room full of women, children, and babies, "Miss Nurse is here." When this woman had learned that a student nurse was coming, she sent out an all call to family and friends, many of whom had little or no medical care at all. Now, I was 19 or 20 years old, and I had zero experience with the norms of infancy and childhood. Now, suddenly, I had a prenatal, postpartum, and well child clinic to conduct. I felt like an imposter because I was certainly no Miss Nurse. I figured what I could do is to talk to each person as privately as possible, take copious notes, and then refer everything to the real nurse. And that's exactly what I did. I was astonished at the variety of health and social issues that came up. During this whole time, there was about a 6-year-old boy standing on a chair in front of the stove, stirring a great huge pot of pinto beans, which we all ate afterwards. I was worried that he might get burnt or injured, so the whole time I'm trying to do my thing, I was also keeping an eye on him, ready to do I don't know what if he got hurt, but I'd try it. I felt incredibly humbled by the needs and strengths of these families, and I realized more than ever how very much I had to learn about life as well as about nursing care. I knew then and there that this is where I was meant to be and where I could make the greatest difference for the greatest number of families in public health. Next slide, please. Yep, that's me. My first assignment was at Letterman Army Medical Center in San Francisco, followed by training in public health and tropical medicine at Tulane University. I then became an Army community health nurse at Fort Ord, California, collaborating with the Monterey County Health Department on a variety of situations. I've primarily worked in home health, community health, and public health since. Despite the setting, the nature of the nursing work can be summarized as disease prevention, education and teaching, hands-on care, and statewide program management. Next slide, please. So let's unpack some of these duties. If you look at all of these different areas I've worked in, it may seem like I can't keep a job, but in actuality, I've only had a handful of employers throughout my 50 plus years in nursing. One of the perks of working in public health is the opportunity to take on different roles and programs. So you can read in this slide some of the fields in which I've worked and programs I've directed. These have been in California, Massachusetts, New Hampshire, Maine, and for the last 38 years in Vermont. I won't read the list to you, but let me just highlight newborn screening as an example. In the International Journal of Neonatal Screening in 2022, Mike Watson et al. Wrote that, and I'm quoting here, newborn screening is one of the most valued public health programs in the US. Through newborn screening, approximately 15,000 newborns are identified annually with conditions for which screening, diagnosis, and effective treatments can be used early to significantly impact infant mortality and morbidity. I was appointed the director of the Vermont Newborn Screening Program in 2000 and stayed in that role until my retirement at the beginning of 2019. Now, just for the heck of it, and because my background's in public health, I decided to compile some statistics for you. Accurate statistics are the lifeblood of any evidence-based public health initiative. So, between 2000 and the end of 2018, there were 116,533 babies born in Vermont. Most likely, some of you on this call today fall into that cohort of babies. My job then was to ensure that each of those 116,000 plus newborns was given the opportunity to be screened, that every single out of range result was followed up on, and ensuring that babies diagnosed with a disorder were treated. Simply put, this program saves lives and prevents disability. So think of those numbers. It's just amazing to think how much impact one nurse can have on so very many families through just one program. That's what public health is all about. It's more than a job. It's a philosophy and a way of life based on a passion for serving others. And this isn't an easy task. Helping people to weed through the morass of junk science, misinformation, intentional disinformation in order to make wise healthcare choices can be really daunting. It's challenging. Next slide, please. So public health programs are ever changing based on clinical science and progress in technology. Advancements in the field of genetics have changed how we diagnose, treat, and prevent many diseases and conditions. I now work with professionals and consumers to educate them about hereditary disorders. Now here's a recent picture taken at NERG's 47th annual educational conference, which attracts attendees and speakers from New England as well as across the nation, and even from other countries. It's a great retirement job. Next slide, please. As student nurses, you'll have the opportunity to explore many fields of nursing. You can't go wrong in choosing any one of them or several of them, but always keep in mind that there's a role for you in public health nursing. Your contributions matter. So thank you for your participation in this webinar and for your attention to my presentation. Thanks.
Thank you so much, Cindy. That was fantastic. And next up, we have Meredith Plumpton from the Vermont Department of Health.
Hi, I would say that my nursing career is probably the polar opposite of what Cindy just explained, but nursing is actually my second career. I started in customer service and project management, and I have a bachelor's degree in psychology. I went back to nursing school in my early 30s, and I attended UVM School of Nursing as well. So in nursing school, all I wanted to do was labor and delivery and postpartum. If you had told me that I would work in public health, I would have laughed hysterically at you. But now I've been with the state for 14 years. I can't imagine doing anything else, and I love my job. So I'm just going to go through a little bit of history of the jobs that I've done. Like Cindy, I've done quite a few. And that's the beauty of nursing, and it's the beauty of public health too. So after graduation, I did do about 7 years at Northwestern Medical Center. I did labor and delivery, postpartum, and pediatrics. I also did some per diem work at UVM-MC in labor and delivery. Hospital nursing is hard. It's really hard, especially when you have a family. I think Alicia said that very nicely earlier. I left the hospital after we expanded our family and the schedule didn't work for us anymore. I did go work at a state-run locked juvenile facility, and we took care of all the medical, dental, and psychiatric needs for the residents while they were in that facility. And a large part of that job was hunting down records, coordinating catch-up care, and coordinating transition services to the community when we left the facility. So from that juvenile facility, I transitioned to the health department, and I worked in one of our 12 local health offices. So in Vermont, we have a central office for the health department, and then we have 12 district offices that are scattered all over the state. And while I was in that local health office, I worked in a variety of roles. So I was the immunization designee. So that role is to assess gaps in vaccine access in communities, to work with your community partners to promote vaccines, and to work with primary care provider offices to improve vaccine rates. And that's through a program called IQLIP. You don't need to know that. But I'm going to reference that in a minute. And then I was also a school liaison. So we worked with supervisory unions and schools to improve the health of students. We educated about the whole school, whole community, whole child model. We assisted school nurses to support students and families' access to care. And some of those examples are hooking children up with dental care, hooking children up with healthcare, immunizations when needed, getting them help in enrolling in Medicaid, getting mental health referrals and services for students. And then I also did epidemiology designee role. So in Vermont, there's a list of reportable diseases that need to be followed up on to determine how you may have been exposed to that illness or virus, and then to prevent it from spreading and others becoming ill. So this includes foodborne illnesses, tick-borne illnesses, HIV, STDs, hepatitis, and then healthcare associated infections. So after about 5 years, I was interested in doing an immunization role in our central office, and I transitioned in February of 2020. I know you all know what came in March of 2020. So I was in that role for about 3 years, but I'm going to say it felt like about 30. So my job was supposed to be to work with all the local health offices to coordinate those quality improvement visits with providers around the state. It turned into being a subject matter expert on mostly COVID vaccines, but all vaccines, educating providers about new or changing vaccines and guidance, and then anything that was asked of public health nurses during the pandemic. So I did a lot of education, I did a lot of coordination, I did a lot of problem solving, and I did a lot of responding to emails and requests. About 2 years ago, I stepped into the immunization program manager role. So I oversee the entire program, which is about 12 to 14 people, depending on funding and fluctuations in conditions. We are largely funded by federal dollars. Some funding comes from the state and medical insurers. And Vermont for vaccines is considered a universal vaccine state, meaning we supply vaccines to enrolled primary care providers and all pediatric and adult patients. So adult patients are 19 through 64. We're able to do this through the federal Vaccines for Children program and the federal Vaccines for Adult program, Vermont Medicaid, and then medical insurers who cover lives of people that live in Vermont. So we work really closely with federally qualified health centers, primary care offices, American Academy of Pediatrics, the Vermont chapter, the Vermont Medical Society, and then Bi-State Primary Care Association, which provides a lot of assistance to our federally qualified health centers in Vermont. And I would say our largest obstacle is the future of vaccines and trust in science. Cindy touched on misinformation and disinformation. And I think that the way we communicate public health messages is going to have to change. And I'm really looking forward to the next couple of years.
Thank you, Meredith. That was fantastic. Definitely picking up on a theme of needing to learn how to cut through the disinformation. Quick plug here. That's actually going to be the theme of our annual meeting this year at the end of April 29th is essentially exactly that topic. How in the age of misinformation do we continue to push forward with our public health initiatives? So quick plug for the annual meeting. And now I'd like to turn it over to Margaret Urban. And I will pull up your slides right now, Margaret.
Good afternoon, everyone. I'm Margaret Urban. I was going to provide an overview of my journey in public health nursing and tell you a little bit more about myself. So I had a really influential nursing professor who encouraged me to consider public health nursing and working for the Vermont Department of Health when I was looking to move back here after working for a large labor and delivery and recovery and OR unit in the Chicago area. I certainly was reflecting on my experience as an undergrad and my rotation with the visiting nurses in the Champlain Islands and just the impact it had on me, the various ways people live and how community plays a big role. So I went into public health nursing. I was a family and child health nurse at the Vermont Department of Health in the Middlebury District office. My work there really involved coordinating home visiting services for pregnant people and postpartum people and their children, really in collaboration with the primary community partners to support their access to care and the services and the needs that they had. I also coordinated community-based coalitions to support maternal health and provided breastfeeding education to families and supported breastfeeding-friendly workplace practices. I moved on to be the public health nursing supervisor in the Middlebury District office, where my role broadened to support the variety of some of the public health programs you were hearing about with Meredith just before me. So I was supporting the role of epidemiology and infectious disease investigation and immunizations and a little bit of the WIC clinic and school health and Healthy Childcare Vermont. So I was really partnering with my staff and the community to support this infrastructure in our community. And then I moved on to be a nurse case manager with Vermont Medicaid with a program out of the Department of Vermont Health Access called Vermont Chronic Care Initiative. And I worked there for 8 years doing home visits and community-based visits with high-risk, high-cost Medicaid beneficiaries who had chronic comorbidities, were often in the emergency department and had prolonged and ongoing hospitalizations. So many of the clients had chronic health issues of mental health, substance misuse, diabetes, CAD, CHF, COPD, et cetera, and we're facing a host of challenges with housing, economics, food security, transportation. And this work was very fulfilling, and I loved partnering with the community-based agencies to support client needs and coordinate their care. My master's degree in advanced populations-focused nursing really supported my deeper knowledge and understanding of community as client, with a very big focus on program planning, program implementation, and program evaluation. There's a lot of things that draw me to public health nursing. Number one, the nursing process at the community level. Number two, prevention and health promotion just resonate with me. And number three, community assessment to inform program planning, using data to program plan and build systems to meet population health needs and improve a better society, just really speak to me. I'm incredibly passionate about the work that I do, and I'll talk a little bit more about that next. But in summary, it's a 2-generation nurse home visiting program that's supporting families to be healthy, have optimal child development, and be connected in their community to meet their needs. It's really rooted in best public health practices. And my advice to any of you looking to consider a career in public health nursing, my advice is try it. You might just love the influence and change you can make on the scale of population nursing. And as you've heard today, there are just boundless opportunities, so many different directions to go in. Next slide. So currently, I work for the Vermont Department of Health in the central office of the Family and Child Health Division. I'm the nurse program administrator for a program called Strong Families Vermont Nurse Home Visiting. This supports families to parent effectively despite their adversities they may be facing in their daily lives to really self-manage their parenting journey. This program receives federal funding from HRSA. It is funded by a grant called MCV. President Obama and the Affordable Care Act created MCV, which has really stood up evidence-based home visiting program across America and into the territories since 2010. The Department of Health and Human Services does a rigorous review of the literature and determines if evidence-based home visiting programs meet criteria for local state implementation. So in Vermont, we have selected the MESH model as our evidence-based home visiting model to be funded by MCV to work with pregnant and parenting children up to age 2. So MCV's a huge infrastructure for evidence-based home visiting that I wanted to bring to your attention. And these programs are really improving maternal and child health, preventing child abuse, reducing crime and domestic violence, increasing family education level and earning potential, promoting children's development and getting them ready for school, and connecting families to resources and supports. Next slide. So in Vermont, we implement the MESH program, and just wanted to call out that the evidence supports favorable results to strongly impact maternal health, child health, and positive parenting practices through the MESH program. The QR code links you to a host of other research behind the model. Next slide. So this is kind of a very comprehensive summary of what might happen in a nurse home visit with a family. There is a specific structure and schedule to the program. So families receive 25 visits beginning in the prenatal period, and this continues up until the child is 2. These visits can occur at home or a place of purpose, community-based place of purpose, or at grandma's, wherever may be purposeful. Nurses are providing clinical assessment. They're doing blood pressure checks. They might be advanced in their ability to support more complex lactation needs. They're offering a host of parental education around childbirth, prenatal postpartum care, newborn care. There's a lot of screening and referral within the adults for perinatal mood and anxiety disorder, substance use, intimate partner violence, and a lot of screening in children for development and parent-child interaction. Nurses are doing weight checks and supporting feeding. A lot of care coordination happening. A lot of care coordination to meet social determinants of health needs. And there's a host of curriculum or parenting skills that are addressed through some curriculum and really support play-based development to help them with their learning, their parent-child interaction, and their social emotional development. Lots of goal setting and behavior change. So that's a summary of kind of the essence of the nurse home visiting program. Little bit about the workforce. I work really closely with the nursing supervisors and the home health nurses employed by the home health agencies that do this work. There is a very comprehensive training that the nurses go through to conduct this particular model. And there are parameters that are part of the model, such as a caseload criteria ratio, and there's reflective supervision that's part of the practice. I organize a lot of professional development in addition to the public health nurses seeking additional public professional development throughout their community. There's additional skill sets that this particular workforce has. As I said before, some of them are lactation trained. Some of them are with certifications in perinatal mental health and have been trained in some other curriculums to support the prevention of perinatal mood and anxiety disorder, and then touch points, specifically the newborn behavior observation, which is an amazing part of the touch points that's really setting up awesome parent-infant interaction and connection. Just want to point out lastly that MESH is an international program, and it is so cool that we get to co-design it based upon our population's needs. So there's kind of core components of MESH, wherever MESH is, in Australia, the UK, all over. But in Vermont, in addition to the core components, we have launched focus modules to address our population needs. So family well-being is really targeting perinatal mood and anxiety disorder and anticipatory guidance about that and setting up supports about it. We're also with a curriculum that supports nutrition and physical activity to help with our population needs in that topic area. And then just recently, I worked with a director of oral health to launch an oral health focus module to help address the significant challenges we have in Vermont with our oral health challenges. So that's all I have for my opportunity to share. Thank you so much.
Thank you, Margaret. That was a fantastic presentation, and thank you for sharing your story. We have a little bit of time, which we purposely left for Q&A. So does anyone on the Zoom call have any questions for any of our presenters? You can also send it to me in a text if you're not able to speak it out. And maybe just to ask one to kick things off. This is a big question, but I feel like we're also in kind of a big moment right now. I was listening to a radio report this morning talking about how many people, especially at the federal level, professions and jobs are either being terminated or are threatened right now, and significant funding disruption. I guess my question for a panelist would be, if you were talking to someone who is starting their career at this moment with perhaps more uncertainty than what we've experienced in quite some time around public health funding, what advice would you have for them?
Public health work needs to be done regardless of the funding. So I know that Vermont is really committed to continuing the work that our program does, regardless of funding. I don't know what that would look like if we didn't receive federal funding. I'm sure that that'll be a broader question. And I don't know how our communities would do without public health.
This is Cindy. I think it's always been a concern of mine that programs should become self-sustaining and not rely on grant funding forever and ever. Certainly seed monies to get a program off the ground are important, but you should always be working for sustainability. So for someone who's new to the field or looking for work, I think the practical advice I'd give was find out how the program or the company you're applying to is funded. You know, how do they make their money? What guarantees are there that they will be able to support their staff financially?
Yeah, I agree. As, Meredith said it, this work cannot not be done. So if you're called to it, go for it, and need some hope that there will be positions and funding to support this very important work in the way of public health staff, locally or statewide. I guess there's a bill in the legislature to support community health nurses, parish nurses, but I'm not sure how that's going to be in jeopardy now with funding from the state. But everybody's waiting to see what happens as the funding, as we get accounting of what funding is coming still and what is not coming still, and the backfill from other programs. It's messy already, and it's going to get worse. But that's heartening to see that bill. It's H. Do you remember, Dana? It's H-140, or I think about supporting local community health nurses.
Great. And I just had a question come in via the chat, and that is, to paraphrase the question, it seems like everyone on this call has had a varied career with lots of different expressions of what it means to be a public health nurse. And the question is, how would you, how do you get a start in a career that has so many different entry points?
There's no wrong door.
Yeah, go ahead, Meredith.
I was just going to say there's no wrong door.
Yeah,
yeah. I was going to say that for me, it came with like the phase of the life that I was in. When I needed it to accommodate my kids and lifestyle, it really opened that door for me.
Yeah.
Great.
Alicia, can I call you out and say also that you worked with the Nurse Family Partnership, the Nurse Home Visiting Program in Rutland as a student?
Yes, yeah, I went to Castleton College, and in the first year that they offered a bachelor's program, I did a rotation with the Nurse Family Partnership, and it was really incredible. At that point in my life, I hadn't been around new babies, and these babies were so tiny, and many of the parents were younger than me, and I was, 20. It was a really eye-opening experience seeing how some of these families lived and the needs that they came home with.
I mean, also to Dan's question, as I was looking over the Colorado stuff in prep for this meeting, they recommend 2 years in a med-surg inpatient setting and then bust out and just start looking for community health and public health based jobs. In Vermont, my love is going, Vermont, we have one health department that goes through the whole state, and then there's just local offices. There's not like county health departments, but that's always a great place to start. Or with the VNAs statewide have the work with Margaret Urban's maternal child home visiting Strong Families Vermont program. That's another great way to get into it. I'm thinking a lot of clinics accept volunteers. Everybody always offers up the, oh, I can never remember it. The clinic for migrant farm workers in Middlebury, Open Door. Another place to get a flavor of it. And the community health nursing, I just love the federally qualified health centers. There's several of those around the state as safety net providers, and a lot of really interesting work there. And the families, it's so much fun to work at those clinics and engage with the families. And that's like lots of, when I started early on in my career in Baltimore, just up the highway from Cindy's work, it was like an early federally qualified health center. We had a team that did home visits, and it was a nurse, me, and a nutritionist and a social worker. It was a great team, and I learned so much from the other two women on the team. As Meredith, there's no wrong door. You can just start looking when you feel you're ready.
I would echo Sally's comment about if it's at all possible to get a solid year or two of medical surgical nursing under your belt, because that's skill those are skills and knowledge that you'll put to use in any field that you might end up working in, including school nursing, occupational health, anything else, and first aid in your own home.
Yeah.
How many of us get called by friends and family and the call starts with, "You're a nurse," and then they ask about their cat's heartworms. So you can't go wrong with a solid medical surgical background.
Wonderful. Are there any last questions for our panelists today?
Do we want to make Molly say something?
Oh, there's Molly.
Oh, hi everyone. Sorry to be late to the panel and miss out on the first presentations, but I'm just so glad we have the opportunity to learn from you all and to learn more about the important field of public health nursing. I look forward to listening to the recording. I'm Molly Lawrence, she, her, the president of the Vermont Public Health Association, and I'm in my kitchen with my kids around, so sorry for the noise, but thank you for sharing your stories. And like it was echoed, the work you're doing is so essential, and I'm just really grateful to have you as public health colleagues in this state. So keep up the amazing work.
Wonderful. Well, thank you again, to echo Molly's comments. Thank you to all of our panelists today. This will be recorded and we'll make it available to a much wider audience on our YouTube channel and on our website. But again, thank you very much for your sharing of your story today.
Thank you, Dan. Thanks for organizing us.
Of course. Okay. Thank you, everyone. Take care.
Thank you. Take care.